Thank you. It's really a great start to the event. And yes, moving on and carrying on forward, we have here with us Professor Vivek Tangi sir. Well, everyone is acquainted with him, but for the sake of protocol, I wanted to say that he is a perpetual learner, carries with him 50 years of learning experience in marketing and sales, mentored by legends late Professor Chitra Mitra and late Professor Tarun Gupta, an author of 8 books on pharma branding, marketing, and sales, a mentor to many B school students, and greenhorn brand managers in the pharma industry. A very warm welcome to you, Vivek, sir.
Thank
We
you
would
very much.
like we would like you to address the audience about the evening.
Thank you and Salam Alaikum. This first day of the World Pharma Brand Managers event is dedicated to the patients and the people of Bangladesh. My salams to all of them. Perhaps you all know that this event is to commemorate or rather perpetuate the memories of Professor Chittamitra and Professor Tarun Gupta, the legends in the Indian pharmaceutical industry. And Professor Chittamitra is also known as the father of brand management. I don't want to take away much time from our very young speakers and panelists. At this point of time, I would just say Khuda Hafiz.
Oh, Shazia, you are on mute.
I am sorry. Thank you so much, Vivek, sir. Thank you. And with this, we can start the evening. And a very warm welcome to Chinmay Mitra, sir, to World Pharma Brand Managers Day 2023. Chinmay, sir, has been associated with CMARC since its inception in 1976. First as a research investigator, later a whole-time director, and now the managing director. Well, I'm going a little off plate here. During his school days, Chinmay was an outstanding soccer player, which made him an excellent team player and stickler for time discipline. He is a passionate about pharmaceutical prescription research professionally, and I would say this passion never ends. With this, Chinmay sir, I would like you to enlighten us with some words on your father, late Professor Chitramitra, along with the importance of patient centricity and the pharma industry.
Thank you, Sajia. First of all, I must thank you, Vivek and Swati, for creating this platform for us. And are you going to share the slides or should I?
You can go ahead, sir.
Good afternoon, Shubho Aparanno, Sabba Khair. Thank you. And the topic is very interesting, patient-centric approach for excellence in pharma marketing, right? So next. Yeah. So this you could see the legend and particularly the doyen in pharma industry today, but he is no more physically. Let me give a brief about him. He started his career in 50s with Professor Prashant Mahalanobis at Statistical Institute, Calcutta. That time it was Calcutta, now it is Kolkata. So when Professor Prashant Mahalanobis passed away, he joined J. Walter Thompson, the then #1 advertising firm in India, right? And fondly known as Hindustan Thompson. The then chairman, Mr. Subhash Ghoshal, actually picked him from Statistical Institute. The purpose to set up market research, because Hindustan Thompson, they known for advertisement, but for doing appropriate advertisement, one should know the customer, requirement, what customer likes, dislikes. So for this, that time he was not professor, he was only Chitta Mitra. So he joined as an executive. And subsequently, he floated that autonomous division, IMRB, Indian Market Research Bureau, and he was responsible for the first commercial market research in India. Earlier, it was, of all government-based, that is actually Statistical Institute used to conduct under the leadership of Doyen Professor Prashant Mahlanobis. So one can say he was a student of Professor Mahlanobis. Then in 1970-71, he got an offer from IIM Calcutta, Indian Institute of Management, Calcutta, as a professor of marketing. They don't have any professor in marketing at that point of time. So with 1/4 remuneration, he joined, because he said, whether I am enjoying it or not, that is more important, right? So now I have, let me join. So he joined, and but by that time he developed a lot of friendship with a lot of people. So and then subsequently become the professor of visiting professor in Harvard Business School and MIT, USA, right? So meanwhile, in 1975-76, our respected, that time again, Mr. Tarun Gupta, initially, he was a managing director of Glaxo. That time, Glaxo has two divisions. One is family care division, and subsequently another division was the healthcare division. So he was promoted from family care division to healthcare division. And in the family care division, that time they have Complan, they have Glucon-D, all those products, right? And he conducted a lot of study with IMRB. So that way he was familiar to Professor Chinmay, right? So when he got the promotion, he don't know anything about pharma. So he came to Calcutta and asked professor that I would like to emancipate the mind of the medical practitioner, right? So what is their mind? Otherwise, how can I influence? And then you see, that time I just completed my school, joined university for pursuing my graduation. So I became the first, research investigator and conducted a lot of interviews late in the evening with the medical practitioners. And weekend he used to come from Mumbai, and then he started interviewing me how I have conducted these interviews, all these things. I used to get a lot of firing from him for not doing appropriate, proving all these things. Anyway, that's a great learning. And then subsequently what happened, this mark, initially it was actually marked under the name of proprietorship of Annapurna Mitra, the better half of Professor Mitra, my mother. And I was one of the staff. So, but what happened, then Dr. Shobhit Chaudhary, the then director of IIM Calcutta, he said, my mother, that do you have, why you are spending so much? Because if professor is earning 100 rupees from IIM Calcutta, Mark is paying 200 rupees as a retainer fee to IIM Calcutta. So please stop this drainage and you float a private limited company, focusing as a managing director. And then subsequently in 80, after 4 years, Mark becomes C-Mark. So that about, and then subsequently, let me keep it short. Now come to the interesting topic with the present situation. And with case study, let me explain how patient-centric approach for excellence in pharma marketing, right? See, today we have mainly two types of data sources, right? So one is sales data, another is prescription data. Sales data, sales data we can procure from secondary data. We have our in-house sales data for any pharma company, and definitely sales data is very important, no doubt. But apart from that, C-Mark, in fact, the mark and then subsequently C-Mark establish this prescription data. And for pharma formulation marketing, we believe for excellence, this is very, very interesting. Now, what is the difference? First, let's see the basic difference between these two approach. One is sales approach. Anyway, any industry, sales is very important. So naturally, that is their sales approach. And another, in pharma industry, the advantage, because the ultimate, user is patient, though in between we have the medical practitioners, right? So see, so if we adopt sales approach, that means to compete in an existing market. So sales wise, we say this is 1,000 crore market or 1 million, 2 million, whatever. So you size up as a fixed, rupee value or volume wise, right? Next is, if you see this patient-centric approach, right? So what are the opportunities there? Create uncontested market. So sky, we can say in one word, their sky is the limit, right? And we'll explain it with example subsequently. Next is beat the competition. There is always, a rivalry if we approach, sales approach. So competition is more rivalry. So instead of having friendly relation, how can I snatch share from you, right? And from this patient-centric approach, make the competition irrelevant, because here we focus the complaint, the problem of the patient. So competition does not arise at all, isn't it? And the third point, there are so many points. Let us focus only 3 points and then we explain it. Exploit existing demand. So what is the role of marketing? Marketing role, as we have learned, to create demand. But in sales approach, the demand is already there. So how can I exploit the existing demand, right? Whereas if we adopt patient-centric approach, then we can create and capture new demand. So again, if you see all these 3 points, there is no competition. It's blue. And whereas the sales approach is red. But anyway, please don't take it otherwise. Don't take me in otherwise. I'm not saying that sales approach is bad or anything, right? But definitely if we adopt patient-centric approach, and that's probably the best way to explore pharma formulation business, right? And may I now request the last line, Vivek, to add?
Thank you very much. Thank you. When we are talking about patient-centric approach in marketing, we have to keep in mind that the patient is the center of all activities, all the marketing activities, all the F&D activities, all the R&D activities, even the HR activities should be directed towards the good of the patient. And when everything is towards the good of the patient, it becomes imperative that one pharma organization, one company cannot do that, one organization cannot do that, and all the pharma companies should collaborate for the good of the patient. One point which Dr. Devasis Basu is going to be talking later on. What is the origin of diabetes? Apart from being a familial disease and health and diet problem, many of the problems of diabetes, they emerge because of poor oral hygiene or poor dental hygiene. Companies which are very strong in diabetes, companies which are very strong in the dental segment, they can collaborate for the good of the diabetic patient. That is what I mean to say, that organizations can even collaborate for the good of the patient. Thank you, Chinmay.
Thank you, Vivek. And excellent. So see, instead of fighting, here we become friends and complementary to each other, right? So now let us have an example and let's explain the today's scenario. Today, you see, since we are associated with pharma industry and interacting almost every day, even in holidays, see the problem whenever we address the problem coming from the grassroots level, that is from medical representative, they said that doctor today, you see, don't have time as proliferation of pharma companies, brand. So doctors, medical practitioners are really very, very disturbed and they don't want to spend time. Whenever they give some time, they said, "Do hi product bolna hai, just tell me about 1 or 2 product or 1 or 2 brand of your company and then push up." And they allotted a very little time, half an hour, say, or not every day. once in a week or twice in a week. And that point of time, we will say 10, 20 medical representative waiting, and they have hardly 1 or 2 minutes, right? So how to address or how to tackle this situation when doctor, medical practitioners restricting MR, medical representative, not to promote more than 1 or 2 brands? In that scenario, how can we promote a basket of brands, at least 4 or 5 brands? See, then we have to adapt again, as we have selected the topic today, patient-centric approach for excellence in pharma marketing. If we adopt sales-oriented marketing, definitely we will end with 1 or 2 products, right? So what is that? So we have to start with indication, right? The moment that any prescription is written for a patient, and from our prescription research, we know what are the indication where doctor is prescribing. Let's take an example of antibiotic, right? We know antibiotic, it's a big basket. We have different family in antibiotic family. Penicillin, you know, we all know that Alexander Fleming discovered that long back, more than 100 years back. So, and after that, there are in that family, antibiotic family, we have macrolides, we have cephalosporin, we have fluoroquinolones, we have all these, you know, families. And within macrolides, we have azithromycin, we have erythromycin. And what we have seen today, particularly in India, azithromycin, this molecule, member of macrolide family, mainly use, any antibiotic is for the management of infection, to control the bacteria, right? But this particular molecule, azithromycin, and the leading brand here is Azithral, promoted by Alembic, mainly for lower respiratory tract infection. For example, say asthma, COPD, you know, that is chronic obstructive pulmonary disease. So all these complicated lower respiratory tract infection, this is being used. Now, if we picked up one indication and start promoting our brand, then we get the opportunity, because the same patient having other complication. And for that, in a prescription, we have seen it's never end with one drug. There are a lot of adjuvant therapy. So what are those therapy? Here is an example, the prescription research. CPR means continuous prescription research, and this data based on all the prescribers, starting from GP, gynecologist, dentist, ENT, diabetologist, but diabetologists normally don't prescribe antibiotic. But whoever prescribe antibiotic, all specialists put together, and this is a chronic therapy, non-chronic, that is acute therapy, antibiotic, right? So with antibiotic, if there are 100 prescription, in 28 prescription, we see it is co-prescribed with anti-ulcerant. So overall, we could see there are a lot of, prescription, co-prescription with the GI, antibiotic prescribed with GI. Then you see if it is a severe acute type or say chronic type of COPD or bronchitis, that create pain also. So for pain management, doctor using NSAIDs, right? Then during, that create also bronchitis to cough and cold, all these things. So in such case, you can promote 4 or 5 products if you have the basket. And another advantage of patient-centric approach, that means prescription-based approach, we know the requirement when GP, what type of patient, what age group of patient, what type of complication a patient visiting a GP, right? So for the management of particular that disease, we can promote that basket, and that way we'll get the full attention automatically. If we talk in your interest, the moment a medical representative put the shoe of a doctor, what is doctor interest? To give relief to his patient, right? So if I talk in his term, his indication, what he is coming, what is his problem, so automatically we'll get his attention, and he will not restrict us to complete my communication with 1 or 2 brands, right? This is an example of acute therapy. Now, Sajia, let's see the next slide. That is chronic therapy. See, for the management of cardiovascular disease, diabetes already, doctor, before that, explain. So diabetes is today is a problem not only in India, not only in Bangladesh, it's a global phenomena. And in Asia, it is rapidly increasing. In prescription also, we have seen that the fast growing disease, that is diabetes, and diabetes is, associated with a lot of other complications. So cardiovascular disease, hypertension. So we get varieties of patients. Only hypertension, that is only 14%. If there are 100 cases, a cardiologist come across the patient, his patient profile, 14% patient or 15% patient having only cardiovascular problem. The rest, you see, cardiovascular with diabetes, then obesity, that is also increasing. So all put together, you see, we can promote a basket of product. And if you see a cardiologist, diabetologist, and consultant for the management of diabetes or CV, most of us are familiar, not only in an average, in a prescription today, we have 3 to 4 drugs. Whereas for the management of CV and diabetes, we have seen even 10 drugs. And average is more than 6 drugs, right? So see the opportunity. So that's why we can, from the same doctor, we can generate number of brand. Instead of, limiting our promotion to 1 or 2 brand, we can generate multiple brand prescription from the doctor. And that, for that, obviously, all of you will agree that we have to adopt patient-centric approach for excellence in pharma marketing. Thank you. Thank you everyone for listening. And that's all.